Hi, everyone, and welcome to this week's edition of CEOs You Should Know. I am Steve Delasan, and I am excited to be welcoming the CEO of USA Clinics Group, which is Dr. Jan. Thank you so much for being with us today.
Thank you, Steve, for inviting.
We're excited to be able to jump into your journey, to learn a little bit about yourself, but also the organization. So why don't we jump right into it? Can you share with our listeners a little bit about your journey from being a highly skilled cardiac surgeon to now becoming an entrepreneur and CEO of USA Clinics Group?
You know, I always say you never know what's the next turn bring. And I guess I'm thirsty for interesting opportunities. And when I have a choice to continue with something that's more predictable versus maybe take a little risk, but open yourself for new opportunities, I'm guilty of taking this choice. And most likely, it's been very, very good for me.
That's
very
awesome.
lucky. So I started as a heart surgeon, and I did my medical education in Russia. I worked in Israel as a heart surgeon. I worked in Italy. I worked in England, and ended up with a fellowship in Harvard and Brigham and Women's Hospital. And heart surgery is an amazing thing. It's pure magic. You know, someone has a broken heart, you stop, you fix it, and it works like new or better. It's absolutely amazing. It also, if you do things right, gives you confidence that pretty much everything is possible if you do things organized right and not take any chances. You know, it's very disciplined thing, and I found a new iteration of magic in after 20 years almost of heart surgery in minimal invasive procedures. Apparently, I learned that you can do fantastic things and cure people without doing major intervention.
Mm-hmm.
You know, surgeons like big incisions. And then they say, oh, we can do big things to small incisions. And when you can do amazing things without any incisions, it's another level of magic, which is sometimes doctors do things for themselves because they love actions, love doing things. But for the patient, what can be better than minimal risk and a great outcome? And that's what's the magic of today's medicine possible. Minimal invasive treatments of very common conditions through needle hole with minimal or no risk and extraordinary outcomes. And that's what kind of allowed me to change the course of my career and focus on this.
That's awesome. That's an incredible journey. So what originally, obviously you've had a very impressive journey as you just detailed out, but what originally initially inspired you to have that passion for medicine, and how has that passion and that vision evolved over the years?
Helping people is great. I mean, if you're just trying to think about the life and what impact you can make, I can't think of something better than medicine in any form and shape. You know, I have two girls. They're in medical school now, and they ask,
Congrats.
Pop, you know, mom and dad, you know, you're not really doctors. What do you mean? I mean, you manage a large organization, you don't see patients, because recently in the last few years, I don't really see the patients. So I told them, well, that'd be nice. We want to be real doctors. Okay, that was a few years ago. And what do you mean? Oh, we want to see the patients like you've done before. So I said, well, that'd be nice to help one patient. Yes. How about if you can help 5 patients a day? Yes, but what if you can help tens or hundreds of thousands of patients? Will that be nice? Is it still? Oh, we got it. So I think when today day and age, you know, with the technology and the opportunities for finding the way to help more patients with a very cost-effective, minimal invasive procedures for common diseases that dramatically improve patients' lives and outcomes and quality and longevity is a great focus of ours. And I think we have an incredible team that also very passionate about this. And it started from vein treatments. Who would think? You know, being a heart surgeon, we, you know, cardiovascular, you know, it's all similar. I never liked doing treatment for veins because it was barbaric. It was terrible surgery. And I could not believe, like, woman or man, doctor, thank you. Not knowing the doctor just did it absolutely torture.
Yeah.
And when new technology came to do much better treatment,
Sure.
percutaneous and the ultrasound, not blindly with a needle hole and the local anesthesia, when patients go home 15 minutes later, it was a pure miracle. And I had these patients that I did a heart surgery that came for veins, and I could not believe that how much difference in their lives these minimal invasive vein procedures compared to heart surgery. Because when people have a heart problems, they don't necessarily suffering every moment. Sometimes they have, we're afraid of heart attack, we're afraid of other things. And if they exercise, they have a chest pain, tightness, but it's not all the time. There are common conditions like a vein, insufficiency when people have swelling and pain and itching and cramping, inability to sleep all the time.
Yeah.
Every day. And, America has a great medicine, but if it doesn't kill, doctors sometimes, okay, you can wait. It's not as important. It will not kill you, but doctors sometimes don't feel patients' pain. And when patients get relief from something like this, that's incredible. And then we learned that we can do more. Because many patients were coming to us not just with a vein condition, but arterial problems. The blood circulation has two parts. Arterial, when the fresh blood comes to the cells, and venous, like a sewer, when we take a waste. So first we were doing this congestion from, venous part, but many people came with arterial. And we learned how to do those treatments in the office as well. And then we learned that we can do many, many other things. And we discovered, I was ashamed to say, I didn't know much about fibroid disease. 80% of black women, 70% of white women over the age of 50 develop fibroid.
Wow.
It's a benign tumor.
That's a lot.
In the uterus. And it sounds like, benign is not too bad. But those tumors really ruin women's life. It creates a bleeding, prolonged heavy menstrual period. It's number one reason for women to lose babies.
Wow.
Because if you have a tumor in the uterus, it competes with baby for space and blood supply. And many, many other things. So basically, complete ruins life. And most treatments were like big barbaric treatments for veins, surgeries, switch to percutaneous, like original treatments for fibroid disease were do nothing, which is not good, or myomectomy, try to open like a C-section, open and try to remove these tumors, but you cannot remove all of them in 2-3 years, 50% come back, or hysterectomy, basically castration.
Yeah.
And sometimes offered in 20s and 30s because women suffer, and that's what was standard of care. For 25, almost 30 years was FDA-approved uterine fibroid embolization, and maybe 1% of women get this treatment. So we kind of took upon ourselves task to educate women to know that there are other options, and quite frankly, bypass gynecologists, bypass status quo, and it worked. And it worked. We helped many, many women with extraordinary results. And number of these similar conditions that's very common, like prostates and osteoarthritis that can be treated percutaneously without any surgeries, just keep growing. So I think we're in the right side of the future, and just, our motto, don't be lazy, keep working.
Yeah.
So that's very exciting.
That is. It's incredible to see the innovation that you're able to bring to the space and be able to do all this good.
And we have about 170 locations, 65% of U.S. population within driving distance to our location.
That's awesome.
So, theoretically it's possible. So eventually we can help almost everyone.
That's great. That's incredible. Well, with all the amazing advancements, I'm sure along the way there may have been some challenges you also faced. Can you share with us what some of those challenges might have been and how you guys were able to overcome them?
Oh, we don't have any challenge. No. So in medicine, I think the biggest challenge is consistency.
Sure.
Because it's, people argue, is it art or is it science? What is medicine? And you might know. Nobody asks, do you know good Starbucks? Everyone asks, do you know good doctor? And it seems acceptable that there are better doctors, worse doctors. People have different opinions. I don't know. I think differently. Being a heart surgeon, I learned that there's certain standards. I always know, what will I say in court? But what if something goes wrong? So in a heart surgery, we're very precise with the indications, like 1, 2, 3. You need to meet certain criteria because the burden of risk is very, very high.
Sure.
So if you subject someone to risk, you better know why you do this.
Hmm.
So we don't take any decision lightly. And I also served in the Navy. So if you do something wrong in the Navy, you end up dead. So it just like looking in the world more like a black and white, yes or no, according to rules or not. So we basically created this imaginary world that don't speed, don't drink and drive, don't just do the right things. And we created a system in our organization. We spent a lot of money and a lot of time create a management platform software that unifies everything that based on the rules. So we help doctors to make better decisions by gathering all the information as much as possible objective from ultrasound machines, from CT, from different things, and presenting to the doctors already matching to every single guideline. So it will save time and make sure that whatever we can do to prevent inconsistency, we do within our power. And doctor using this technology achieve extraordinary results. Like, for example, for fibroids, our need for recurrent procedure almost 25 times less than published data because of this consistency. Yeah. So I think that's the biggest challenge, how to achieve better results consistently, sure. And it will dramatically decrease cost of care and provide a lot of transparency. And I think that's what we need, right? And decrease cost of care, so there will be enough care for everyone.
Sure. I think that consistency and high standards allows you to have all the different locations across the country and have
Correct.
That confidence that the care that anyone is getting that visits one of those centers is going to be
we can deliver
standard.
What we promise.
Yep.
Correct.
That's awesome. So you yourself pioneer in a lot of advanced technology, but I know something that is very important to you is providing high quality care to the underserved communities. What drives your commitment to this mission, and how do you see this approach evolving in the future?
I like excitement to make a difference. You take someone who's the sickest and make a difference. It's important to help a little bit, but sure. To me, it's more exciting to help someone who suffers a lot. The reality is an underserved community. Unfortunately, people, even if they have access to care, I can't say that they don't have access to care. They have Medicaid, they have maybe even better access to care than anybody else because it's free.
Yep.
But they don't use it. Maybe a matter of education, maybe a matter of other things. So solving this gap and helping patients that suffer the most because of whatever the reason they didn't have a benefit of using the care excites me a lot. And most of our doctors are very similar. Heart surgeons, vascular surgeons, interventional radiology, people that went to medicine to make a difference as much as possible. So it's kind of very much aligned, we like to make a difference. Yeah. There's pathology and problems in underserved population, and I think everyone benefits. It just kind of fits like a glove. And there's a lot of work there, a lot of work and a lot of positivity. And when people happy and thankful and you make their life better, it's invigorating. It's really what excites us and what moves us. And, it's not difficult. We enjoy what we do, and have so many doctors work really, really hard. And they have one doctor, he was a heart surgeon. Maybe he came to us 65 years old, and maybe 2-3 days a week. He worked 6 days a week, worked really hard. And I asked, Steve, why do you work that hard? I don't work. I have the best time of my professional life. I enjoy every moment, and he is phenomenal here in New York and New Jersey. So all of us like this, and it's just, I think that's why people should go to medicine to make a difference.
Yeah, it kind of is full circle to when I originally asked you why you went into medicine, right? It's to have that passion and to help people. And I think that it's refreshing and awesome to see that trickling down to this important
I practice
community.
in 5 countries. I visited 64 countries. And so I can tell you there are many ways to practice medicine, and the goal is to innovate. The goal is, it's not where's the pack now, where's the pack going. Just imagine there's in 3-4 dimension space where you want to be in certain point of time and space in 1, 5, 10 years. just have a great team and work towards the goal. And I think that's absolutely possible today.
That's great. Well, we touched on this earlier. Minimal invasive procedures have really become the hallmark of your practice. Where do you see that role advancing in other shapes of the healthcare industry or other healthcare delivery outlets?
It's a great question. Fee-for-service, like today's medicine, I can honestly tell, the opportunity in U.S. care is extraordinary.
Mhm.
Can be. But overall results are not as good as could be if you compare it to the cost and many other things, because incentives is fee-for-service. So people focus on treating what they call chronic conditions. That means the condition that never go away, and it always brings fee-for-service. It's a great business. We're in terrible business. I think the right thing is to cure conditions.
Mhm.
Find the problem and just fix it. Cure, make it like touch and go away. That's a magic. It's maybe not a business, but medicine is not a business.
Yep.
Medicine is about doing the right things. And I believe that no country can spend 50% of GDP, or no employer can spend 50% of payroll on healthcare.
Mhm.
So eventually music will stop, and the right thing will be overwhelmingly the right thing for everyone.
Mhm.
Just cure.
Yep.
And in my opinion, what we do decrease cost of care maybe tenfold, maybe 20. For example, fibroids. When women suffer 20, 25 years, overall cost of care can be $150,000 to $200,000 or more.
Wow.
Between all the treatments and
Mhm.
infertility treatments and especially not going to work and not having career. And it's just extraordinary. For, I don't know, $10,000, 20 times less, you can have a cure.
Mhm.
That's fantastic.
That is fantastic. Yeah.
Vein treatments. 1 or 2% of Medicare population, 65% and older, have ulcers, broken skin, and ulcers that completely limit them from veins, from congestion, from poor circulation, and the cost can be $100,000 a year
Yeah.
in perpetuity. Our treatment is single digit. It's nothing,
Yeah.
and it prevents this disease. People, I don't look at this. When I spoke with a large insurance company, they look at what is the most expensive thing for them. Chronic conditions, heart, cancer, other things. And they, in today's world, like, how can we control? What do we need to do? I think they need to think a little different.
Yeah.
How we can either cure or how can we prevent? And I think the most exciting thing for me and for hopefully USA Clinics and maybe for healthcare is to make sure people live longer. 70% of death are preventable. It's at the heart or cancer,
It's an
literally
alarming
50-50.
stat, right?
But what's important, preventable, is it sounds like crazy, but it's
Yeah.
true. If you find cancer in stage 1, it's curable. By definition, stage 1, when it's at very, very beginning, it doesn't protrude, doesn't go anywhere that it can spread. So you fix it, and that's it, like you never had a cancer, if you find it.
Yep.
So I'll give you an example with lung cancer. I think that it's getting better. And it's getting better because, amazing thing happened. People decrease smoking. Who would imagine this 20 years ago? Would never imagine.
Yep.
New York City, restaurants, no smoking. No, we all live in the new world. And early detection. 15 million Americans can have for free scan of, a CT scan. And before, 5-year survival was 3 to 5%. And now, find earlier can be 95%, 5 to 10 year survival.
Wow.
Complete turntables. And heart, people mostly die from unknown heart disease.
Mm-hmm.
Because as a heart surgeon, I know if you diagnose, it's a mechanical problem. Almost everything can be fixed.
Mm-hmm.
So early diagnosis is critical. And if you find it early, then make people live, and it will be very cheap.
Mm-hmm.
The only thing is, medicine is built today fee-for-service. So if patient doesn't produce revenue, like chemotherapy and other things, it's not very good for business of medicine. So I think we need to have a big shift in incentives and focus. That's not this, but actually what's important. The outcomes and decreased cost and the best outcomes need to be rewarded. Don't know. I can't necessarily for myself and make this difference, but we can do our part, just try
Yeah.
to provide the data, be available, again, 65% of U.S. population within a driving distance, and keep talking about this to the right people. And who knows, now new administration,
It's true.
let's hope for the best. And,
Mhm.
there's a lot of effort to think about health and the longevity. And people talk about all the biohacking and other things. Don't know. We can talk about a lot of mysterious things,
Mhm.
but we can talk about very easy, understood, and practical things like early diagnosis.
Yep.
Cheap and make a huge difference.
Yeah.
So I hope this message will be heard, and I'm pretty sure it will be. Because, eventually the right things come out. Many people think at the same time, and when it's enough push, it will happen.
Yeah. It's an important message that a lot more people should be listening to, right? It still saves you on the monetary side, but also long term, better quality of life.
And USA Clinics is based on education of patients, empowering patients. Even in underserved community, it's not
Mhm.
like just opening offices in a bad neighborhood in Bronx. No, it's just educating the patients, educating about options. And I think for patients, for people,
Mhm.
get patients, like people, taking care of the health, they have one body.
Mhm.
I heard Buffett once talking to, students or someone to give example. Like, if you would have a one car for life, would you take good care of life? I mean, like your body, your
Yeah.
health. If you just have one, would you take care of it? And I think we need to think this way. That if that's your body, you need to, if you want to have a long, productive, meaningful life,
Mhm.
you need
Gotta
to have
take
a
care of
body
it.
that functions.
Yeah.
And so I think today with the technology, we can, like planes don't fall from the skies, right? And they can be 100 years old
Yep.
because of redundancy and proactive maintenance. And if we'll have the same approach to the human body and the
Ourselves. Yeah.
healthcare, it can be extremely safe and predictable and inexpensive and scalable. So I'm very excited where we're going. I think we can really discover new healthcare and new life, and hopefully, 100, 120 years old will be in a
Yeah.
good shape,
Yeah.
functioning. I think it's achievable.
Well, I love that positivity. I hope you're right, and I hope we do move in that right direction.
Okay, asking my thing. I'm right.
Another impressive fact about yourself is you were the founder of the Chicago Heart Institute, founded to tackle complex cardiovascular conditions. What inspired you to create that, and what is the legacy you hope it leaves?
That was a long time ago, when I was a heart surgeon, and I really like what I'm doing. And it's interesting. When I started at University of Chicago, I had the shows on the radio stations about heart conditions, and if you have a shortness of breath, if you have this, just let us help you.
Mm-hmm.
And part of the Chicago Heart Institute was how do we bring top-notch care to patients by educating them and providing access, transparency, instead of overcomplicating and just saying all the strange words that people don't understand. We just need to provide the best care to the patients with the knowledge and try to eliminate as many as possible middlemen.
Mm-hmm.
And, you know, from this, it just transitioned to other minimal invasive treatments that I can help instead of 1 or 2 patients a day to 20
Mm-hmm.
or tens of thousands like we do right now in our amazing organizations with the 100 plus fantastic doctors and great staff. And I think I'm very lucky, very
That's
lucky.
awesome. Glad to hear that. Well, I know we talked about this a little bit earlier, balancing between your business acumen and obviously your experience within the clinical and medical space. How do you feel like those two experiences combined make you a better leader in this space?
I think when we being in touch with reality, understanding how to help the patients. I don't think you can be, I think the most effective healthcare leader can be a doctor who thinks scale and about consistency. If you think too much, oh, I'm a doctor, from doctor's perspective, oh, I'm a doctor, I'm so important, I learn so much, I need to get paid a lot. It's wrong. Think from the patient perspective. How can you help one patient? How can you help a million patients? And if you don't know how do you help 100, you think, how can you help 10,000? Until you find solution. And I think using technology today, there's the EMR. There was a great thing that happened in the last 25 years, bringing electronic medical records. But most of electronic records, it's, garbage in, garbage out. It's just like fancy Word document.
For sure.
It's not structural data. You can put anything. And that's why things are confusing. I don't think even AI can read this and understand because, people are people. They sometimes put whatever the minimum they can get away with. We approach very differently. We think that knowledge should be gold and everything is structural data. So when you have a data that's absolutely meaningful, every single thing, yes or no, definitive, and you put on top of this rules, best practices, and you track outcomes, it's incredible. That's the tool that we use to treat, achieve outcomes, and talk about this and track, and I think it's very scalable. I hope this approach will be patient first and structural data and rules first before, oh, I'm a doctor, I know. I think that's what allow medicine to be much better in the next few years, and I'm sure many others will use this approach as well.
Awesome. Well, another great approach that you do is while you've been recognized for a lot of the great work you're doing in medicine, you've also been recognized for a lot of the great work you do on the philanthropic side. What advice do you give to other healthcare professionals or those that are just entering the field to not lose sight of the importance of giving back and being involved in the philanthropies out there?
I think it's very important to think about big picture, why you went to medicine, helping people. And helping people, it's not only, prescriptions, it's not only surgeries. Just educate people about ability to live better and longer and achieve more, maximize their life. I always tell that our goal, for example, with fibroids, is to give women the best version of her life as early as possible. And I think anything that we can do to advance it, for example, we have Fibroid Fighters organization. That's we've found me and my wife, Dr. Flora, maybe 7 or 8 years ago, and that was amazing, educating women about different options. And when you have a good idea, many great people join, with this energy and contribute, and it just grows beyond a regional scope, much larger. Another example that I really like, it's a Save a Child's Heart. When I was in Israel, we were doing heart surgery on kids from around the world, and we got a United Nations Award in 2018. They treated more than maybe 7,000 patients, kids from all over the world.
That's great.
Maybe more than 60 countries for free, and established heart surgery in many countries, Ethiopia, Tanzania, and it's unbelievable. So I think always need to think. When I was a heart surgeon, I knew 2 words when someone called. Thank you very much right away. That's all. You never ask, details, insurance, this. Just like, thank you for your trust.
Yep.
Let me do the best. And I think everyone who goes to medicine or even healthcare need to think this, and it's beyond just job.
We touched on this earlier, but I think it's an important topic to dive a little bit deeper into, which is access to healthcare, right? It's not just an issue here, but really globally. It's become a very pressing issue. What advice would you give to others in the healthcare industry to change that? And how do you believe an organization like USA Centers is changing that way?
I think it's exciting opportunity because of technology. The people say medicine is local. I don't know. It's not necessarily, oh, you have a good doctor around this and you can access. I think medicine's more about information.
Mhm.
It's about knowledge, what's possible, and doctor need to have a couple advanced things like head to get the data and maybe butt to sit and learn. Today, Dr. Google can be smarter than doctors. I truly believe that because with the information that constantly updates, it's possible to have a system that's really up to date on many things. What it means, like driverless cars, provides absolutely new opportunity for transportation. Sorry to say, but doctorless medicine, to me, is the key to scale and give extraordinary care anywhere for almost free.
That's great.
So I'm actually extremely optimistic by utilizing technology and bringing the medicine what doesn't require surgeries or other things, basically free anywhere in the world. That becomes not local, global.
Hmm.
I maybe we'll get to the point that maybe access to care will be a right. I don't know, things that were not possible 20 years ago, I see maybe realistic within very, very short period of time. We have a software that we actually have between 70 to 100 software engineers. We do it for maybe 13 years already.
Wow.
That builds system for everything from voice over IP telephony to control and track every conversation and EMR that knows everything as a structural data and rules with digitalized rules of doctors and patient engagement, like basically guidelines that's a bunch of PDFs and tons of books with digitalized that it can in real time match symptom signs objective findings to all these rules and guidelines and suggest the best actions that cost effective
Sure.
and extremely effective as outcomes. And I think it can be used beyond our organization needs and beyond just procedures and expanded. So I'm very excited what lies ahead of us, and I hope we can make USA Clinics, very generic name, can make a broader difference and not even maybe even beyond US.
I love that. Well, I'm excited to see the future and what's in store for you guys next. We covered a lot today. Do you feel like there's anything that we might have missed that you want the listeners to know about USA Clinics?
USA Clinics has about 170 locations in 33 states. We have more than 40 locations in New York City alone. So I love New York City.
Yeah.
And we provide cure for many conditions: vascular conditions, venous insufficiency, arteries, fibroids. Women's health, prostate. We okay to take care of men as well. Instead of big surgeries, we can just shrink prostate with a minimal invasive percutaneous treatments. Now we treat osteoarthritis and we're always evolving. And what I can tell about USA Clinics, that because of the approach and data-driven approach, I hope we can deliver great outcomes to every patient that comes to us. That's at least our very hard work and intention. And they can find us on usaclinics.com, USA Fibroid Centers. But the most important thing, everyone needs to be in charge of their health.
Mm-hmm.
You just have one body, take care of it, with us, not with us, but just don't ignore it.
Yep.
Don't take chances. Don't hope for the best. It's possible to have long and happy and productive life. Don't ignore it.
That's awesome. That's great advice.
Steve, thank you very much. That was amazing, spontaneous invitation. And,
Absolutely. I always love to ask one last question. So there is no doubt in my mind that based on your story and your journey and the future work that you're going to do, you're going to leave a legacy in the field of medicine. For anyone tuning in that's thinking about entering the industry or have that passion to be able to help others, like you said earlier, what advice would you give them?
Aim high. Aim high and know your stuff. I mean, it's really everyone that asks in our organization want to be very tall people. Like have a strategy, think beyond horizon and dream and just don't waste your life on small things. At the same time, You need to be boots on the ground, really good at what you do. And this combination, if you can groom yourself to be, like this, you'll have exciting life and make a lot of difference, no doubt.
That's awesome. Well, thank you so much for joining us. It was an absolute pleasure learning more about you, learning more about USA Clinics, and all the amazing work you're doing. So thank you very much for coming in.
Thank you, Steve.
Awesome. Thank you guys for tuning in, and tune in next week for next week's edition of CEOs You Should Know.